Hi, welcome to Undercover Boss. We have the CEO of our hospital here.
Wait a second, I thought it was Diary of a CEO.
I like that better.
Okay,
Welcome to Talking with Docs. I'm Dr. Paul Zalzo.
I'm Dr. Brad Wing. Today we have a guest.
Hi there, I'm Melissa Farrell, President and CEO here at Halton Healthcare.
President and CEO of our regional healthcare here. 3 hospitals, is that what we got here?
That's right, 3 hospitals, 9 community sites.
Okay, and we thought it would be cool to figure out, how did you become a CEO? What got you into this?
Well, the truth is, when I was a teenager, I was really passionate about social justice, and my family was in government, and my grandfather actually worked in a hospital in housekeeping, and I sort of fell into it. I always really wanted to be in, supporting government and healthcare, and honestly, I worked for Ministry of Health for a long period of time, and then ended up working on hospital-related projects, and honestly, ended up here. Like, it's actually a pretty incredible journey for me to be here, to be honest with you.
Wow, social justice as a teenager. That's just like you, Brad. On your mind all the time as a teenager?
Paul was like trying to catch frogs, probably, when he was a teenager. So after high school, so what did you do after high school? If someone's like, listen, I really want to get into the government kind of area of healthcare.
Yeah.
What did you do after high school? What kind did you go to university?
Went to university. I did my undergraduate in politics, and then did my master's degree in urban and regional planning. Sounds weird, but to be honest with you, you can actually do urban planning focused on social justice, so social planning and healthcare planning, and that's actually how I ended up in healthcare in particular, was really a focus on health-related planning. So planning the future of the healthcare system is actually very cool.
Okay, and then you just walked into the hospital and the first job you got was CEO?
Absolutely, that was job number 1.
I didn't get that job, that's why I'm being an orthopedic surgeon.
Yeah, that's right.
Okay.
Actually worked in corporate planning at University Health Network, so downtown Toronto, and then ended up going to the government to work on all the government's major priorities. So wait times, worked on, in fact, all the major initiatives related to wait times throughout probably 10 years, and then progressively moved into what's called an assistant deputy minister. That's like a VP in government, and then came out as a president at St. Joe's in Hamilton, and then ended up here.
Okay. So you went from government type work to the hospital work.
That's
Is that
right.
the usual direction? Don't you go usually hospital work into government?
I know, I'm a unicorn.
So where
okay?
people are like, you're going the wrong way.
Going the wrong way, but in fact, government really, I think anyway, is an excellent career for anybody to be thinking about when they're thinking about healthcare, because you get the experience of understanding everything that's going on at the highest level. And then here, I wanted to come and be closer to patients. So I really came to the hospital sector so that I could interact with patients more directly and have a better connection with you guys. So physicians, nurses, the rest of the staff.
And that's what I think is what's unique about socialized medicine, is that it's kind of like a business, but it's also run like a government, because
That's right.
there are the same issues of balancing a budget and the money side of things, but it's not a for-profit venture, so the goals are slightly different, despite everyone trying to provide good health care.
That's right. I would totally agree with you on that.
Okay, so in talking about government, talking about running a hospital, how much politics is involved in running a hospital? I mean, that's a broad question, but...
Actually, quite a bit. So to be honest with you, there's a lot of relationships that are required when you work in socialized medicine between the providers, being us, and our funders, and really making sure that we kind of share with our funders how critically important it is for us to be doing certain things. So their support really matters. There's a few things that we can be doing on our own, but the vast majority of what we actually do in the healthcare system, we have to be doing in partnership with government, and in some circumstances at the direction of government as well. Right. So yeah, really, really matters. Those relationships are very, very important.
Okay, so you're trying to convince government this is what we need to do.
That's right.
That's why we need this funding.
That's right.
Okay, and then what are the pressures coming down from government then to you?
Well, the pressures to be honest with you, the pressures in the healthcare system are actually pretty common anywhere right now, and have to do a lot with what's happening in terms of the complexity of the patient population for which we currently serve. So the truth is, we're seeing the baby boomers get to a stage where they're starting to age, and in fact, the vast majority of baby boomers will be 65 and over by 2030. And so we're running into this period of time where most of the population that we're treating is very complex. So government is very focused on that. how are we going to be addressing the demands on the healthcare system? What do we need to be building in terms of long-term care capacity, the surgical capacity that'll be required, medical capacity, so medicine. So what's the healthcare system going to need to look like in order to support this patient population? And the thing that's even scarier is that it's also impacting our staffing. So the expectation is that we're going to be able to do more complex care with less people because that's actually what we'll have.
Yes.
Yeah.
You have to, out of
That's
necessity, right?
That's right, out of necessity.
Wow.
So we got to be innovative and creative
Wow.
and integrated. There's lots of exciting things that we can do, but that's the pressure on the government right now. It's also the pressure on the hospital right now. Probably the biggest issue that's happening in healthcare pretty much everywhere in the world has to do with this population that's currently aging.
Yeah.
Okay, and how much do you see how much do you lean on the rest of the world? Like, do you say, okay, this is what's going on here, let's see what's going on in Sweden.
Norway.
Yeah, absolutely.
Sweden, Norway, that's cool.
That's where all the happy people are.
Oh, is
according to
that
those
what it is?
lists
Is that
they
why
always
we
do.
picked that?
Norway's supposed to be the happiest, I think.
Yeah.
Well, I think we do that a lot, actually. So when we're developing policies, for example, and thinking about the future of our healthcare system, we just are in the middle of doing our clinical service plan, for example, and thinking 20 years out. We're spending a lot of time looking at what other jurisdictions are doing, and not just other Canadian jurisdictions, but actually what other countries are doing around things like integrated care and how they're building in precision medicine and how they're thinking about artificial intelligence and digital solutions and all the new innovative creative things that we need to be doing in the healthcare system. We're looking at other jurisdictions to see how they've been able to do it and how we can be incorporating that here all
Okay.
the time.
All right. So speaking of looking at other jurisdictions, so if you look at in many other countries, there's a big proportion of private medicine going on. So privatized healthcare
Yeah.
is common in a lot of places in the world. Not very common here. There is a little bit of it. What's your take on private medicine and its integration with a publicly funded system? Is it possible to have an integration, or do you think there's no place for it, or do you think there should be more of it to inject money in?
I'm personally a very big supporter of our healthcare system the way that it is largely done today. I think it's a misnomer to say that our healthcare system in Canada doesn't have a private aspect to it. So there is actually, we don't have private pay. So there's very little private pay that exists here, but we certainly have private providers all over our healthcare system. Private providers that support long-term care, for example, in the home care industry, for example. So there's lots of that exists within our healthcare system. And it works because the pay system, though, is still through one centralized payment process. And so I really, truly, like me personally, again, this is my personal opinion, really believe in that. I think there's more opportunity, though, for us to be collaborating more effectively with the private sector, especially as we think about things like artificial intelligence, like I was just talking about, precision medicine as another example. There's lots in surgery where we really rely on vendors and work with the private sector and should be working more explicitly with them too. So I think there's more opportunity, but I'm still a big believer in the publicly funded healthcare system as we have today.
Love it. Love it.
Yeah.
I don't know how you feel. Yeah.
Paul, go ahead.
Wow,
What are your
I
thoughts?
I love working in a system where it's publicly funded. I like the fact that I can treat all the patients equally. You know, it doesn't matter where you're coming from, how much money you have, you all get the same treatment. Personally, I really like that, which is probably why I ended up staying in Canada after I finished. When we finished residency, we were getting offers from, you know, a lot of countries that do have private healthcare, but personally, I made the decision to stay just because I like that fact, like being able to treat patients regardless of where they're coming from. That's my drive.
Yeah, and I'm with you. I think the Canada Health Act's important. I think as Canadians, we really cling to that universal access. I think that's important. I think I agree with you too, though, that we can be better at it. And is there a role for some type of hybrid? I think it's just like AI, to be honest. I think you have to be really careful because once it starts, it would be hard to stop. And it'd have to be really, really strictly regulated and governed. But I think there is a potential role as long as the bottom line is it improves access for everyone. So not just the people that have the money,
That's
fine,
right.
they get it faster, but as long as that translates into reducing wait lists for the people that are still in the public system, I think there's a potential role. It is super tricky though, and I don't envy the people trying to make those decisions.
Yeah.
Yep.
Yeah, I think it's tricky. I mean, I have a lot of respect for people who do work in those systems because they require a certain skill set to work in that system, for sure. Different than our skill set in terms of marketing yourself and all of that. But just like our channel, like we are sponsored by, we joke, we're sponsored by Mother Nature. She hasn't cut me a check in a while. He's sponsored by kale. I'm sponsored by the chicken wing. But because of that, we find we're able to give medical information that we feel is useful,
Right.
and not burdened by underlying biases.
Right.
If you had
And
to
free
pick,
for all, right?
it
To
is
everyone.
100%. If you had to say, what are the top 3 challenges? Would you say we can go locally or bigger? Like at our hospital, if you say, okay, listen, these are the 3 things that we not are worried about, but that are active issues that we're working on trying to solving acutely. What would you say off the top of your head?
I would still go back to what I was saying before, which really has to do with that demographic shift that we're
boomers.
seeing. So it has to do with the boomers, but it's impacting from a leadership perspective, actually, who we are relying on within the organization too, as our leaders within the organization. So as a Generation Xer, I'll just tell you that this generation in particular has actually been sort of passed over for leadership positions. So it's interesting now that we're seeing this big retirement actually happen with our healthcare workforce, trying to find the leadership of tomorrow. There is sort of a whole generation that sort of got passed over, and making sure that they have the leadership capabilities for the future is really a primary priority for us, for sure.
Okay, so
Yeah.
aging population, a double-edged sword, because
Yep.
we're going to treat the public
You got it.
like that, but then within our organization, we're losing that leadership. So leadership.
Yeah.
Okay, number 1. Number 2, next big challenge.
Well, I feel like leadership is second to that,
Okay,
right? So one
okay.
is the complexity of the patient population.
Okay.
Second is that leadership capacity and capability, making sure we have the right staffing, not only at the leadership level, but all levels
Okay.
within the organization. So I think that's really kind of, maybe that's number 3, right? So
Okay.
number 1 is complexity. 2 is where are we going to find the leaders of tomorrow? And 3rd is staffing.
Oh,
How do we
man.
make sure we've got the right staffing for the future, for today? So it's for today and for tomorrow.
Okay, and now your favorite things. Your
Yeah.
3 favorite things about doing what you do.
Favorite things about working in healthcare? Well, first off, patients. So being able to interact directly with patients, and often at the CEO level, it's because there's a complaint or some concern. But I would say to you, as a non-physician, so I'm not a doc, I'm not a clinical clinician. You already heard. I did my master's in urban and regional planning. So often I actually feel this connection to patients because my experiences with the healthcare system can be very similar. So
Yep.
that interaction with the patients, I think, is incredible. But the second is just being around these amazing healthcare workers who are so passionate about the healthcare system, so passionate about our patients. It's a vocation, okay? People get into healthcare because they love it. I appreciate there's a lot of burnout that's happening in our healthcare system too. But being around people who are so committed and dedicated and passionate, I would say, is my number 2 in terms of the
Okay.
best parts about the job. And then 3 is I love the government stuff. So being able to work with all those colleagues that I had in the government, be able to really put business cases forward and get commitments to things that we know are going to be really important for us and for this region brings me a lot of joy.
That's funny because I've never used love and government in the same sentence.
I know,
but,
I know.
But I'm impressed that you were able to do that.
Well, you kind of have to.
I
I mean, the
guess,
best
yeah.
part about being a CEO is that you have to fall in love with
Yeah.
the job. You have to fall in love with the place that you work. And I've sort of spent the last year falling in love with this place.
Okay, and you like us better than St. Joe's?
Yeah.
I'm just
Yeah,
joking. You
totally.
can't answer. All right, well, that's awesome.
They're all my children, right?
Yeah. Any last message you want to give people?
Maybe you want to too. We want people to get into healthcare. So
Yeah.
again, to be honest with you, we're not going to be able to recruit ourselves out of some of the challenges that we have in the future because we don't have the population to do that. But it's actually a cool time to be in healthcare because what's going to be required is for us to be innovative. It's going to require us to be integrating. It's going to require us to be thinking differently about healthcare, how it can be delivered in the future. And we need more people to be passionate about that. So
The 3
that would be
I's.
my message.
Innovative, integrating, and intelligent. There you go.
There you
That's our
go.
new motto.
Exactly.
And I would agree with that. I think it's an exciting time for healthcare. If you do like this kind of a job, I think the number of opportunities that are going to be available for people are really limitless. If you're willing to put the time in and find something that you like, I think healthcare has so many opportunities, right? From, like you said, working in administration, being a nurse, being a doctor, being a
That's right.
physiotherapist, an RT. There's so many different jobs inside the hospital that can really pay back, and you get as much as you get.
Exactly.
Yeah, you can tell that Brad and I like this job. We have a good time doing it, but I mean, there's a lot of stress, a lot of headaches, and a lot of hard times, but it is rewarding. It's a really rewarding career. We enjoy it.
Amazing.
All right,
Excellent.
well, thank you so much
Yeah,
for
no
taking
problem.
the time out of your busy day to join us and educate us about how to run a hospital.
Yeah, and
thank you.
thanks for watching. If you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health. And leave some questions in the comments that you want the CEO of a hospital to answer, and we'll bring her back to answer some more.
We'll see you
Thank
next time.
you.